Hey guys, it's JillianVita. Welcome back to my channel. Today I'm going to do a video that was actually requested, and it's going to be all about my braces. So at first I was kind of unsure if I was going to do the video because I didn't know if there was like a big enough audience of people that would want to know about braces, especially having adult braces. But then I remember before I got my braces, I came onto YouTube to look to see if there was a video that kind of gave me the things that the doctor's not going to tell you, and I didn't really find too much. So I'm just going to give you my insight on my braces experience. So as you can see, I have these rubber bands in my mouth on both sides. And the reason for that is that it's adjusting my bite. I'll get back to it in a little bit, but I do have to wear these pretty much all day long except for when I eat and when I brush my teeth. So I sleep in them and I pretty much go the entire day with them. But let me start from the beginning. So how it started was I was going to get veneers because I just didn't really like the shape of my teeth. They're kind of large, as you can tell. So I wanted to get veneers, and then I went to the orthodontist to see what he would recommend and to see how many veneers I would need, etc., etc. So when I went there, he actually said that he didn't recommend doing veneers before I got dental correction because if I did, my bite would always be off. The midline, which is like right down the middle of your teeth, would be off always. And plus the way I've been biting and chewing, it's wearing down my teeth a lot. So sooner or later, I kind of wouldn't have much teeth left. So that was kind of alarming. So I knew that I had to get my teeth a little more aligned and my bite more aligned before I could even consider veneers. So then we went on to the option of getting my teeth straightened and my bite fixed. So there were a few options. One was surgery to get my bite fixed. And I knew for sure that was not something that I was willing to do because basically they have to split your like the roof of your mouth in half and then separate it, and I just wasn't into doing that. So that was a no for me. And then they had obviously the options of clear braces, which are the ones that you see that look almost like plastic, and then there are ones that go behind your teeth. There are the metal braces, and then there's Invisalign. So I know most adults would probably go for Invisalign, and that was something I was considering as well. But my orthodontist kind of recommended to not go with Invisalign if I wanted the best results in terms of my bite and my alignment, because one side I have a crossbite and the other side I have an overbite, and he said that Invisalign is really not going to help with that. So because we were going to need to do a lot of rubber band work, and Invisalign doesn't really offer the option of using rubber bands. So I just kind of bit the bullet and I decided just to go for it and do it properly and just get metal braces. So I got my braces in November of 2016. So I've had them for about 8 months now. I've noticed a really big difference in my bite, meaning that my teeth close different. The way I chew is different. And when I speak, I used to kind of speak out of one side of my mouth. And now I notice that it's a more even mouth movement when I talk. So that's pretty cool. The pain at first was bearable. It wasn't too bad. It just felt like it was a little bit tight on my teeth. I first started off with just the top. So for a month I had just the top. He kind of wanted to straighten those out a little bit because I needed a little more work on the top. So he went for a month with just the top, and then we added the bottoms. And I didn't have rubber bands for about 4 or 5 months. And then I had rubber bands only on one side, and if you could see into my mouth, which I'm not sure if you can, they're like 2 buttons back there, and there used to be rubber bands that would loop behind there and come to the front and come to the bottom of one of my brackets. So that was basically to expand my bite. So now I have rubber bands on both sides, and that's also again to expand my bite and to align it. So a lot of people look at my teeth and think your teeth are kind of straight, like I think you're done. And the reason is because again, my bite is going to be off, and if I don't fix my bite, I'm going to grind my teeth down eventually until there's basically no enamel left, and then your teeth are really prone to becoming decay, and that's when they start to fall out, and you have a lot of like dental disease, and obviously that's something that I want to avoid. So I'm just doing it this way for now and keeping on the braces for as long as I have to. I think he said there's about 8 months left in my process, so I'm about halfway through. The costs will vary. I went to about 4 different orthodontists. I live in LA, and the area that I live in tends to be on the more pricey side. So I went to 4 different orthodontists, and the prices range anywhere from like $3,500 up to like $8,500. And that all depended on what you wanted. Like if you wanted to have something that would expedite the process to make it a little bit quicker, it was more expensive, and that's a more like technical procedure. But for me, honestly, I just was okay with just doing the traditional metal braces because I feel like it's worked for so many people forever. So why should I, you know, why should I not just go that route? If it works, then why try to do something better than already has been around forever? So I just decided to go with traditional. For me, my eating hasn't really changed too much because I don't really like chew on apples like whole. I always cut them up and things like that. But I know for sure I've broken brackets from chewing on carrots, so I can't really eat carrots unless I cut them up. Brussels sprouts, again, I have to make sure that they're not as hard because they can break your brackets off, or your wire can snap off as well. I don't chew gum with them, so I couldn't tell you what that's like. Other than that, I don't really feel like my bagels, I can't really eat bagels and things that are like tough like that you have to cry a lot of chewing because they can, break your brackets off. Also for me, it's kind of uncomfortable for me to eat in front of people, I'm not gonna lie. So I tend to kind of like eat safer things in front of people, like drinks and coffee and yogurts and stuff that's not going to get caught in your teeth because things get caught in your teeth. You have to brush your teeth basically after every single meal. So what I do is I carry around like a dental kit, which has floss and toothpaste and toothbrushes and little picks to go in between your braces. So it's kind of a little bit of an annoying extra step, but it's necessary because you have to make sure that your dental hygiene is actually even better when you have braces, because when the food gets caught behind your braces, it's actually like worse than had you not had braces because, obviously your food can kind of just like slide off, but with braces, it'll keep your food onto your teeth, which can cause decay. So you do have to make sure that you brush your teeth even more often and that you floss even more often than you would normally. That's super important. I go for checkups and my rubber band replacements or my wire replacements once a month. So that's pretty standard. It takes about an hour. I'm in and I'm out. It depends on what we're trying to do in terms of where my progress is. So sometimes I might have to change my wire to a thicker wire. And when that happens, it is a little bit tight for a few days and chewing does hurt. But not so much that it's unbearable. But when I had gotten my rubber bands for the first time, these rubber bands, actually when I slept, it was really, really uncomfortable the first night or two, but I just took some ibuprofen, which is, recommended, and I was fine after that. So like I said, I have to go every single month, and then they either change the wire out and make it a thicker wire to basically, make it tighter. So because when your teeth align, obviously you have to tighten it up so that it continues to shift. And then obviously my rubber bands get changed every single month. I don't really pick colors. I have seen girls with colors, like girls my age with color, and I've seen like lavenders and pinks, and they're gorgeous. But for me, I like the traditional minor iridescent clear because it kind of minimizes the look of the braces on my teeth, and that's just what I prefer. Your rubber bands will get stained if you drink coffee or teas or anything with kind of a color like a cola. I don't drink soda, so that's not really something that I can attest to, but I'm pretty sure since I know that it does dye things, it's going to stain your teeth. Or like berries for sure are going to stain your rubber bands. So just make sure that you brush your teeth after you drink coffee or after you eat anything that's going to stain, just so your rubber bands aren't changing colors more rapidly, because if they change colors, they can get yellow and they can make your teeth look yellow. So with that said, all of my braces my brace experience has been pretty good actually. I mean, I was a little shy when it came to like smiling and like talking with my mouth wide open because I didn't really want people to kind of like notice my braces because I am older and I'm an adult with braces. But I'm definitely glad that I made a decision to get them. It doesn't change like behaviors like, like kissing and stuff like that. That's not really affected. It's all pretty much the same when it comes to that. But like I said, it was a little awkward for me at first in terms of just having them on, just because I felt a little bit self-conscious. But after a while, I kind of like them. I think they're kind of cute, and they make me sort of unique. People sort of comment anytime they see me, they ask me about them, and they just like seem to be a little more friendly actually, because I guess it's sort of like a childlike thing to have braces. But for me, I don't know, I think they're kind of cool right now. When I do get them off, I'm going to have to wear a retainer probably forever, just to make sure that my bite and my teeth stay aligned, and all of this work wasn't for nothing. I'm not sure if I'm going to get veneers afterward. I'm not sure. I might just get my teeth bonded just to even out the shape, just to make them like a better shape from my face. But I'll cross that bridge when I get to it and when I get my braces removed. But as of right now, my journey's been okay. I can't complain about it. I've grown to kind of love them, so it makes me unique. So if you have any other questions, feel free to leave them in the comments and I'll answer them in there. Other than that, I'll see you guys next time. Be sure to like and subscribe, and I'll have plenty more videos up. Mwah!